welcome back and thanks for being with us here on Morning Live. Now, the National Institute for Communicable Diseases says that 3 COVID-19 deaths were recorded in the latest 24-hour reporting period. The NICD also says that the total number of deaths from COVID-19 in South Africa since the start of the pandemic now stands at 90,348. However, many experts say that the real death toll from COVID could be 3 times higher than the number we are currently reporting, given the number of excess deaths recorded in the country since the start of the pandemic. The NICD says that the coronavirus test positivity rate has now also jumped back above 30%, and that's 6 times more than the rate at which the spread of the virus is considered to be under control. So to help us unpack some of these figures, what they actually mean, we join on the line now, or should I say virtually, by medical expert Professor RAMNEEK AHLUWALIA. Prof, good to see you again. Welcome to Morning Live once more.
Morning, Sikani, and morning, everyone. Such an honor. Thank you.
So let's start with your overall observation of the current numbers and Omicron and what we've seen with this variant of the COVID-19 virus.
You know, it's like a hurricane now. You know, it's this is not like the previous second wave or the third wave of the original coronavirus, where the virus takes time to mature and the bell curve goes gradually up and then it reaches its peak and going down. This is a severe hurricane that has come. It's a new variant which is mutated and has found some escape mutation possibilities, which means when it enters a human body, it tries to become invisible for our human defense system to recognize it initially, but eventually our human system still does overcome it. So it's like a hurricane of infections at a very quick pace. And we also anticipate it will disappear also very quickly. But the time the hurricane is going to stay with us, which is this month in crucial time, it's going to cause a rapid rise of infections, highly contagious variant. But there are also some positive signs that we are seeing, which is that the infection remains mild. And there are 3 big possibilities that we are now looking. Still early to say, we're just about 3 weeks into this new hurricane of Omicron. But what we're clearly seeing is that there are 3 things that are working so far for us. One is that 60 to 70% of South Africans who actually got infected with COVID, which we anticipated during the first, second, and third wave, produced something called a natural immunity. And that's holding its camp somewhere down the line, that they are fighting this Omicron better than comparative to people who had not got the natural immunity. The second thing, which is obviously the game changer, is vaccines. That the vaccine immunity, irrespective of the breakthrough infections happening, the virus escapes the immune system for a while. But at one time, the vaccine immunity, which we call as T cell, recognizes this variant and produces the immune system so strong that it overloads the viral load of the Omicron and protects severity of a disease. And the last part, which we're still going to find when the scientists will eventually decide, is has the virus lost a bit of its virulence? So far, too early to even explain that part. But definitely, things are working in favor for us. That's why the hospitalizations are extremely low. Infection still remains mild to moderate. But at the end of the day, it's a COVID. It will affect the non-vaccinated the most. It will affect old and comorbid people. And we need to watch out because every life matters at the end of the day.
So, Prof, just to pick up on the point of the virulence of the virus, and I take the point that you make that it's too early to tell, but can you just explain to us as layfolk what that means, the virulence of the virus, also in context of, as you pointed out, Omicron and the mild symptoms that we've seen go along with that?
So, Sikani, it's actually when we talk about viruses in general, and what we've seen from history. See, viruses are very strange. They sometimes can catch our intelligence to what we predict better than they think and how we can. So you only can know it with time. But usually and generally, the viruses tend to become milder. And when I say about the virulence, it's about the infection. So when the virus enters our human body, It binds to our human cell. When it binds to a human cell, it enjoys binding more better to a human cell because that's where it gets its food, that's where it survives, because that's how it is surviving, by living with our human cell. And then it starts multiplying and reproducing. And when it multiplies and reproduces, it produces something we call it as a viral load, which becomes too much into our body. And that is the time when our own immune system starts tackling the virus, and a fight starts happening between the human body cells, which is our natural immunity, and the virus, who has multiplied into millions of its own sister brothers in our body. So the virulence means that the virus eventually is not replicating to that level, and the virus eventually is not being more severe in the form of infection comparative to its sisters, like we saw in the beta or in the delta. Again, Sakani, it is too early to predict that. But one thing is for sure, as you rightfully asked, that we are seeing mild infections. 10 times low at the same levels of people who became positive, 10 times low we are seeing the number of hospital admissions compared to what we saw in the second wave or the third wave, which is clearly seeing, as much it's still a bit early, around 3 weeks, and we still have to see how the trajectory of the virus behaves as weeks pass by, as it takes time for the viral load, it takes time for the virus and the human immunity to overcome. But the early signs are very clear towards what we are understanding is that either the natural immunity plus the vaccine immunity and a bit of the virus losing its virulence, all three possibilities are holding a camp for humans at this moment, which is a good sign for South Africa and a good sign for the global world so far.
So speaking of immunity and, of course, vaccines at the moment, lots of questions around the efficacy of the vaccines administered in South Africa, the Johnson & Johnson and, of course, the Pfizer vaccines. So let's talk to that for a moment. Around 40% of the population fully vaccinated at this point. So how is that assisting this fight, Prof?
See, to be very honest, this is going to decide the trajectory not only for the fourth wave, but even for the fifth, sixth, and other waves that's going to follow, because this virus is mutating. Even though this virus will mutate and form its shape and color, that it can still try to escape our immune system, but it won't be able to escape so far, and we've not seen any variant so far that can escape what we call the second line of our defense system, which is a T-cell immunity, which the vaccine produces. So what happens is eventually the virus starts entering our human body, starts multiplying, becomes a viral load. But we have what we call as a 3-tier system in our defense, in our natural immunity. And when it starts hitting our second or third defense system, it cannot escape it. So eventually our human body puts our immune system so stronger that it eventually starts overcoming what we call the viral load of the virus, which means that the vaccines are very effective. Specifically, so breakthrough infections might happen, which means that people will get reinfected, but will get reinfected with some mild symptoms, with some moderate symptoms. But eventually, your vaccine immunity will overcome the virus eventually, which is the good sign, because eventually, what the vaccine is helping us is with three things. Number one, it is definitely hitting the severity, which is it's not letting the virus overcome our body like the way it did in the second or the third wave, where we had oxygen therapies to be needed, ventilators for people, and eventually we lost a lot of people because of overwhelming of hospitals or ICU or lack of oxygen supplies, etc., because eventually the vaccine immunity is taking over. The second thing the vaccine also does is that when the virus moves very nicely from one human to the other, because it's highly contagious and it is moving, and it finds a body where it is not vaccinated, it can sit and hide and start mutating further. And when you have a vaccine inside your body, it will also have a high chance of not allowing the virus to mutate that much, which is also importantly for the whole world to watch, because that's the only way we can come out of the fourth or the other waves or the fifth or the sixth waves that we have to follow eventually because of this mutating virus. And the third thing is that the vaccine further reduces the chances of transmission also. It reduces quite tremendously because once your viral load is suppressed by the vaccine immunity, you will also spread less. And that is what we are hoping, and we are trying to protect more vulnerable lives, which are highly vulnerable to even any other variant, including Omicron, to not be able to transmit to the level it's being transmitted right now.
And Prof, you know, there have been, of course, talks and comparisons about what happened with the Spanish flu and how that ultimately died out and what we are seeing currently. And without getting way ahead of ourselves, if we could just talk to that in terms of, you know, whether it's a given now that the symptoms as the virus mutates would become milder and milder until ultimately, you know, it's not a thing anymore, or should we actually still be very guarded? Because is there still a possibility that this could still mutate again into something that could resemble second, third waves, as you said, that required oxygen and very serious medical intervention in some patients?
You know, what we have to watch is that, first of all, I want to start by saying that every variant of COVID needs to be taken seriously. Even after Spanish flu left and the influenza virus started living with us, influenza flu virus, which happens in a season, spreads to schools, colleges, and comes to homes and spreads very rapidly when the flu season comes, still affects the vulnerable people, which are the old and the comorbid people, even till today. We lose a lot of lives also because the flu virus eventually, because the old bodies or the people living with comorbidities are not able to take that much amount of viral load, and it leads to severer multi-organ diseases or pneumonias and stuff, which still happens in current days. So what we are going to be watching with COVID is, for one sure, one thing I can guarantee you is that if we are looking at from this new variant that's come up with like a hurricane right now, what I've spoken about, Omicron, is that the natural immunity plus the vaccine immunity plus possibility of a low virulence is holding the camp currently, which gives us an indication that going forward, there is a high possibility that the future variants might move in the same trajectory as it is. Cannot say in certainty, but for now, this seems to be the trend, exactly like many other viruses do play the same trend, which is a very good sign for the global world. At least our deaths will fall down, severities of infections will fall down, but people will still keep on getting infected, reinfections will keep on happening, and we might have to supplement boosters in order to avoid even what we call as reinfections. But this is something which is a very tricky question for any scientist to answer at this moment. I do anticipate 2023 to be again living with COVID, and unfortunately that looks like to be the scenario, which means not going to be like a Spanish flu where it will suddenly disappear, which means it will take time to disappear, as most of the people in many parts of the world are still not vaccinated, which will still allow a lot of the virus to still give a chance to make mutations and still find ways to penetrate into our human system and try to evade our human system. So which means that we probably have still a time to live with this virus. We can only hope that our natural immunity and the vaccine immunity, like it's seen in Omicron so far, will work so beautifully for us that the infections will become more timid, more smaller, the virus will become more tamed down, and this is exactly where it will gradually move out of human life, but not in 2023, and we still have few lives to be protecting right now.
And just going back to the efficacy of the vaccines, Professor, those who are skeptical of vaccines overall would say there's now talk of booster jabs, and just looking at the efficacy of the J&J and Pfizer against Omicron, some people would say, well, given the statistics that are put out, it probably isn't worth taking, to stave their argument against vaccination. But how do you respond to that?
One thing I wanted to let everybody know is that all vaccines that have been approved by the World Health Organization or SHAPRA in South Africa have clearly shown its effectiveness against the severity of the infection, predominantly why they were made, to avoid many people dying and many people being in hospitals, because to be in the ICUs, having oxygen and putting onto ventilator, it still kills a lot of your internal body system eventually, still, even if you try to recover. But we also lose a lot of number of lives. So the severity part, which is the immune system, which is our second and third line of defense, is built by the vaccine in such a way that it will and it tries to overcome the virus, even though the virus tries to escape our vaccine immunity, which we have clearly seen. So when the virus enters, it tries to become invisible for our first line of immune system to recognize it, which means it starts multiplying and we do see mild and moderate infections. But what the vaccine efficacy has clearly shown is that eventually when the T cell immunity picks up, or when the virus is recognized in our body, our body still takes over the vaccine. So vaccines are really holding the fort for us. And any vaccine, whether it's a J&J vaccine or a Pfizer in South Africa, even the other vaccines that were produced in other parts of the world being approved by WHO have clearly shown the similar trend as we've seen with Pfizer and J&J. But one thing we also want to inform everyone is what we've seen with Omicron is that you are liable to get a reinfection, which means that vaccine also, when it puts an immunity, any immunity that is built, weans off with time. And that is the reality of our immune system, which means when you put a double dose vaccine and you are about now 5th month or the 4th month, your vaccine immunity slightly is falling down gradually. Doesn't mean that it's not going to hold your camp for severity of infection. It will. But you are more liable that the virus will take a little bit more toll out of your body. It will have more viral load. It will cause more symptoms. But eventually what we are seeing is the vaccine immunity is taking over. Clear data from current hospitalizations versus number of deaths that are still happening due to Omicron. And I think that's what people need to realize, that what the booster eventually will be deciding is it's going to be made around the new variants or how the virus is changing its shape and color. And secondly, it will re-energize your body or boost your body with the further immune system, which where the waning immunity was going down, it will jack up back into its 90% efficacy. And that's exactly what the world unfortunately needs to realize of how to live with the vaccines eventually.
And Prof, we have about 30 seconds, but I just want to ask you about Omicron and Delta. So the focus on for the 4th wave is obviously on Omicron, but are people still contracting Delta, or how does it work?
So, what happened was when the Delta wave came, it actually infected many. In fact, we do not know the exact number. We know that 70% of South Africans were infected during the 2nd and 3rd wave and the 1st wave predominantly, which means they got infected. But when Delta came, we had a very dominant variant called Beta at that time. The Beta variant was the one which we saw in the last Christmas holidays and went long wave till February. But Delta occupied its space as soon as it came in middle April, May in our country. And what you see is that within 2 months, that Delta variant became the dominant variant. Doesn't mean Beta was wiped out. Beta still remained, some of the infections did remain continuing with the Beta variant, but Delta took over. We also have other small variants of interest like Lambda. They're all still around in South Africa. So the infection, when it moves from one human to the other, decides which strain or which variant is moving from one person to the other. But because many South Africans were anticipated to got Delta, there was an immune system that was built around the Delta. And currently, the way Omicron has come, it's been highly contagious. The way it spreads, clearly what we are clearly now seeing is that 90% of our current new infections are from Omicron, which means it's leaving 10% bracket alone for other variants, which is predominantly by the Delta, but we also have few other variants of interest still in that 10% left, which are still spreading around in our country. But that number is significantly, completely low. And this is exactly what Omicron is, a hurricane, a highly contagious variant. and has a complete dominating power over the Delta. So in South Africa, 90% of infections are currently Omicron, and Delta and Beta has become very suppressed. In other parts of the world, Delta is still a very dominant variant, while Omicron is now coming to overcome it. While in South Africa, we've already experienced it.
Prof, we're into news time. Leanne wanted to ask a question about the contact tracing. And given what we know about the mild symptoms associated with Omicron, what are your views on that? You know, should people who've been in contact with someone who's contracted COVID at the moment still be isolating for 10, 14 days? Or what should happen at the moment?
I fully agree with the Ministerial Advisory Committee point of view, predominantly because they are absolutely justifying their reasons that there's no need for anyone now for contact tracing, for isolation, specifically with the way now COVID is going to spread further. Natural immunity is there, vaccine immunity is being jacked up, we're seeing milder infections all around us. And one thing is also becoming clearer, that your PCR test, as well as you becoming able to spread the virus, will only start about a day or two before your first big symptom starts coming in. So it's not fair to be isolating and businesses to be kept aloof because people are absolutely going into isolation, and specifically healthcare workers, because we are in constant touch with so many positive people. Every time we are in touch with somebody below a distance of 1.5 meter, we cannot be isolating ourselves. Otherwise, who will produce into our economic conditions or economy as such? So the reality is that contact tracing and quarantining was one time needed when our immune system was not to the level that we can defeat this variant the way we could not. When this original virus came, we never had an immune system. It was absolutely new for us, and we come to this disease far more severely than currently. And looking at our current immune systems, natural immunity, vaccine immunity, it does not make sense. So it's very much like becoming like a flu virus, where you have a flu, you start showing symptoms, you go home, you rest, you isolate yourself, but only if you have symptoms and if you are testing positive. Not for people who are around you, because it is highly possible that people around you will remain mostly asymptomatic, predominantly that the immune system will take over their system.
Professor Ahluwalia, always a pleasure speaking to you. And that's medical expert Professor RAMNEEK AHLUWALIA helping us unpack and understand the latest COVID-19 numbers and, of course, some of the symptoms and the mutations, and warning against complacency during this festive season.